Welcome back. Now, following the novel coronavirus outbreak, the World Health Organization updated its protocols in line with case detection and testing of samples. Now, according to the Noguchi Memorial Institute for Medical Research, the current regimes or protocols have become important in detecting early cases to avoid spread. Professor Bosompem is the director of Noguchi, and he speaks to Mama Bioso Abuaje ahead of a briefing to the University of Ghana Medical School and the presidency on the updates so far and some peculiarities in the suspected cases that have been handled so far in the wake of the outbreak. Check this out.
Since on Wednesday late afternoon had reported themselves to the Kolebu Teaching Hospital, suspected that they had the coronavirus. We had to wait till a bit later on in the afternoon on Thursday, and then the Noguchi Memorial Institute for Medical Research came out with the test results, which was negative, thank God. And we would learn later on that we've actually tested 9 suspected cases, all proven negative. This morning, I've come to the Noguchi Memorial Institute for Medical Research, and I have the director of the institute, Professor Bosompem, for an interaction. Good morning to you, sir.
Good morning.
Thank you for hosting us.
You are most welcome.
So you explained to me that this building right behind us is where the testing happens.
Yes, actually, the building behind us is called the Noguchi Memorial Institute for Medical. Actually, Noguchi is part of the University of Ghana. So it's the University of Ghana Noguchi Memorial Institute for Medical Research, Advanced Research Laboratories.
Okay.
And that's where the testing is being done.
All right. So just confirm to us these 9 cases. The only one that was publicized heavily,
yes,
obviously, was the one that happened at the Kolebu Teaching Hospital with the test results coming out on Thursday.
Yes.
Explain the 7 other cases to us.
So we have tested 9 cases, as you all know. And these 9 cases, they have all turned out to be negative. You know, Noguchi Memorial Institute for Medical Research of the University of Ghana is actually also the National Influenza Center for Ghana. So we have actually been in the forefront of the global health protection as far as influenza is concerned in the country.
Okay.
Now,
go ahead, Prof.
Okay, so in the country. So we already test for influenza viruses. And then we also have the capacity to test for the coronaviruses, because human flu that causes the common cold are a whole range of viruses. We have the influenza viruses, and then we have the normal coronaviruses. And then occasionally we have some coronaviruses that are not in humans, in animals, that can jump into humans. So the novel coronavirus, for example, is one of them. And we do test for these. The way we test for them is that when we are screening, we screen first of all for influenza. And then we screen for corona. Corona, which means, scientifically we call it pan-corona. So, which means anything that is corona can be detected by the test. And if it comes out positive for the pan-corona, then we test for the novel coronavirus.
Okay.
So that's how we do the testing.
So I'm a bit curious, because this virus just happened. I mean, it's something that we haven't seen before.
Yes.
So how then did we, suddenly we are also in the position to test for a novel coronavirus? Where did we get that expertise from?
Yes, actually, this is a very good question. It happens to be so because the Noguchi Memorial Institute for Medical Research of the University of Ghana is a forefront flagship Medical Research Institute. And over the years since we established in 1979, we have maintained one character, being always one step ahead of all the research laboratories. Mostly in West Africa, we are leading. And we maintain cutting-edge research with state-of-the-art equipment. So that gives us the edge to be able to meet the world as far as new, emerging diseases are concerned. That is one thing. The other thing is that science has become now such an art that when there is a new pathogen, we now have what we call genetic sequencing of the genome or the genes. And so the genes can be sequenced, and when it is sequenced, you can write the sequence on paper, and this can be published. So the Chinese, for example, sequenced the gene of the new coronavirus and published it. Now, once published and comes to the general scientific domain, all scientists now can make effort to do something to help to control the situation. So working with some of our partners in the US, NIH, National Institute of Health, and things like that, we're able to acquire the unique gene sequences that can be used to detect the novel corona.
Okay, so did you physically have to take your men there for training?
No, we didn't have to do that because at Noguchi we already, we are already a leading biomedical. We are a reference laboratory for the whole of West Africa, and we have our staff already trained in all these advanced molecular, systems and testing and sequencing and bioinformatics. So we have people who are already very well trained to do that. But once we acquired the test and we started, standardizing it and having it to work and everything is okay, we also send people outside for more training, and people also come here for training. So as we are speaking now, we have 15 West African countries here at Noguchi, undergoing training in advanced parasitology, bacteriology, and virology.
Interesting.
Yeah.
When the test results came in on Thursday, the good news really, because a lot of people were hoping, really praying that it would be negative, and then it turned out to be negative.
Yes.
Somebody suddenly said, are we sure? Did we just let them go after one testing?
Okay, that's a very fine question. What we do, because these situations of global health emergencies are very serious matters, we ourselves have to be sure that what we are telling the public is correct. So one of the things that we always make sure is factored into the test that we do is what we call controls. So any test that we do has positive and negative controls. The positive controls are known novel corona, other corona that are not novel, and influenza. And then these are in the test panel. So if our positive controls don't turn out to be positive, then it means if the sample is positive, perhaps it won't turn out to be positive. So this kind of control systems make us to be sure about the results that we get, that we have.
Okay, so once we get the news, we should trust that once Noguchi says it is negative, it is negative. We shouldn't doubt that.
Yeah, you shouldn't at all, because Noguchi actually is working, even not alone. Our system of testing and reporting and everything, we have the algorithms, we have the standard operating procedures, which are all certified by the World Health Organization, WHO. The West African Health Organization is working with us, WAHO. The other, major stakeholders like Africa CDC, they are all working with us, and everything that we do is standardized.
Okay, so kindly explain to us, you get the samples, you don't take the samples yourself?
Yes.
So you get the samples from the facility.
Yeah.
But does it mean if there's any suspected case anywhere else in the country, they have to bring the samples only to Noguchi to get the results?
Yes, actually the question you asked has two components. We don't take the samples, but the hospitals, the laboratories that take the samples have been given the standard operating procedures of how to do it. But in case they don't do it right and it comes to us, then we shall ask for another sample.
How would you know that?
We can know because we have early screening criteria. Okay. For example, before the samples are actually analyzed, we have to take it through a first stage of extraction of genetic material. So these viruses are not like human beings. We have DNA, but they have RNA. We have to extract RNA, and the RNA must be potent. So if there are issues with the extraction of the RNA, it immediately indicates so. And sometimes you will find that swabs are used to pick the samples. If the wrong swab is used, for example, that one you may even see that, look at it, this is cotton, it's not the material supposed to be used to take the swab. So there are various measures that we use to tell.
So far 9 cases, any peculiar challenges with the samples?
And there are no peculiar challenges. What we have found rather is that the 9 cases, all of them are negative for corona. A few of them are positive for normal influenza.
Okay.
And you may find occasionally maybe the normal corona, which is a normal.
So are we too alert? Because ordinarily these 9 cases will probably not would not have been referred to Noguchi? Is it because we've heard corona, so we're too alert? Anything that looks like it, just a little bit, we become suspicious?
Actually, anything like it, just a little bit will come to Noguchi.
Okay.
Because so far in Ghana, Noguchi, the University of Ghana Noguchi Memorial for Medical Research is the only laboratory which is testing for the novel coronavirus. But one thing that we do traditionally is that when we start doing such specialized testing, we quickly build the capacity, for example, of the National Public Health Reference Laboratory and some of the health and some of our partners so that this can be shared. Because now, as we speak, the West African Health Organization has contacted us and we have confirmed that we are ready to test samples from the sub-region. So samples could even come in from any other country.
Okay.
And that means that we need to be able to spread the capacity to be able to test.
And we have the capacity to do that.
Yeah, we have
for
the capacity.
Entire West Africa.
Exactly, we have it. You know, for example, in 1986, when the HIV/AIDS pandemic became a reality in Africa, the first HIV/AIDS case in Ghana was diagnosed at Noguchi. And then after that diagnosis, we built the capacity of the Ghana Health Service to also do the diagnosis. And then when they are able to do it well, then Noguchi takes another standing or another specialized role of, let's say, quality assurance or no certification, you know, things like that. And we move on that way.
Okay. One of the earlier challenges that we heard that the Institute had was test kits. And I don't know if you have enough now. What does that even mean? Okay,
you know, when you say test kits, to a scientist, most of the times it will ring a certain bell. That a packaged test, that is a kit that you can even give to an individual to test. Coronavirus testing is not that way yet. The testing is being done through laboratory setups, and it should be done even in secured environment, you know, highly secured by safety, by security environment. But then when you look at it loosely, test kit may also mean that reagents, the materials that you use to pick the swab and things like that. We have quite a reasonable number, but we really need to augment that stock because it's some minimal numbers that we have now.
Okay, and where should that come from, the Ghana Health Service?
Naturally, since the Ghana government is our immediate resource, as a country, the Ghana government, the Ghana Health Service, Ministry of Health are the first, you know, line of providing the resource.
Okay.
And already a lot has happened and gone on, and resource is not really a big deal now because we know that within this week, for example, there will be quite a lot of even money to buy the things we need to
because
buy.
the minister was even in Parliament last week making some assurances and talking about the budgets that's been put aside just for the coronavirus. But challenges with PPEs as well, your workers who are testing. I kind of cringe, like I don't know, first of all, tell us about their mood. I mean, they know they're testing for coronavirus. What's the attitude?
Yeah, interestingly, because of the nature and the level of the University of Ghana Noguchi Memorial for Medical Research, our staff are already highly exposed to such risks. We do test various things that are unknown, some of which can come out to be anything. It could be another hemorrhagic fever, yellow fever, it could be chikungunya, it could be so many other things. So they already have the exposure. So the mood is good. Except that this time round, we have had to set even in place shifting motions that some people are working in the night, some are working in the day, you know, and all that kind of thing. So it's a little bit stressful, but they are okay.
Okay, so after the Thursday case, have you had new samples? I'm
aware after the 9 there has been another sample which we have tested, but the results will be released by the Ghana Health Service.
Okay, okay, but you know the results, except that you wanted to come through from the Ghana Health Service. But from the way you were smiling, I guess that's another negative result.
And of course, when new samples come, as director, I'll be briefed this morning, so I'll know what's happening.
Okay, let's talk about the West Africa proposal that we are ready to take on.
Yes.
What would it mean? What would it mean to us as a country?
What it means really is that we are in a global family, a global village. and the countries are interdependent, depending on one another. And when we are fortunate, like we are in Ghana, to have such highly specialized resource like the NMIMR Institute for Medical Research, then we have to also ensure that we leverage that resource to the benefit of all. Because the whole situation has become such that in this world today, global health security has no boundaries or borders. And if you don't do for your brother or your sister, very soon you yourself will be in the same trap. So it is good for us to be that forthcoming for our sister countries. And it is also good for us to provide the training and the capacity building. But of course, we also require that, how should I call it, the resources and the collaboration from the others, which so far we have it and it's so good.
Okay.
It's good.
Okay. All right. So as it is now, we shouldn't be afraid.
No, we shouldn't be afraid at all, because the main thing is when it comes to this kind of emerging, re-emerging pathogens in the world, the main thing is your ability to prevent. After prevention, your ability to detect or diagnose, and then your ability to contain. And as far as we are able to put in place all the preventive measures, and then we are also able to put in place the various measures for detection, which we are doing now, then it means that we should be able to manage the situation.
Okay. All right. So just for the sake of clarification, because I'm also as curious, also scared within, but obviously talking to you this morning, I am relaxed.
Good.
How often do you do the test before you come out and say the result is negative? Is it a one-time test?
Not necessarily. We have systems. We have systems that are involved in the testing. Specialized equipment. Some of the tests are, let's say, the technical terms, PCR, some are nested PCR, etc. So when you test, the reliability of the test can also be indicated. So reliability may be 99.999%, that kind of thing.
Okay.
So when you get it like that, you are sure that this test is right.
Okay.
But then when you get the reliability of the test and it's like 70%, you know that you have to test again.
Okay.
But usually it doesn't happen like that.
Okay. Thank you very much, sir, for your time. Thank
It's
you
a
for the
pleasure.
confidence.
Thank you
really.
very much too. Good.
Okay, so there you have it, live on the AM show, Director of the NMIMR Institute for Medical Research. This is the only place really where when we have a suspected corona case, we think this might be symptoms of it. This is the only place where we test, and so far all the results, all the testing, the samples that have come through have been negative. We thank God for that. But you know, some people say it's just a matter of time. Do you believe the same?
It is, but it is not. Because if you look at recent experiences that we had when there was the Ebola outbreak, how come that Ghana and Liberia are so close, so many people sharing many things together, yet Ebola never came to Ghana? So I believe that we should just hope and believe in our God. This corona, novel corona, may never get to Ghana at all.
Amen.
Amen.
Thank you for watching.
Good.
Mama B taking us behind the scenes there at Noguchi. All right, well, Showbiz is coming up right after these. Stay with us.